Yeah, so I mean this presentation, I guess, is really aimed for trichologists more to be aware of the guidelines, standards, and then really just it's really quite a massive overview of a lot of different topics, but hopefully it will just give you a bit of an insight into what is going on in the industry, what you should be looking out for, and hopefully will help you to signpost effectively. So when you're seeing patients, you know, which sort of surgeon should you be referring to, and which clinics might be more reputable perhaps than the others. So we'll get started. And also, just before we do start, there's an awful lot of references to different organizations and guidelines, etc. But there is a slide at the end with all of the references, and Ian's going to send that out afterwards, so you can do your own reading in your own time. So really, to start with, what are the standards in hair transplant surgery? And I mean, it really starts with the GMC, so the General Medical Council. So you've got the GMC, you've got the JCCP, and the ASA, and you've got the CAP, you've got the British Association of Hair Restoration Surgery, and then the ISHRS as well, as the Royal College of Surgeons. So there's an awful lot of different organisations which all provide some guidance and standards for us to work to. So the GMC starts with really professional standards for doctors, and it's built on core guidance of good medical practice. So primarily, make the care of your patient your first concern, be competent and keep your professional knowledge and skills up to date. Prompt action in regards to patient safety, establish and maintain good partnerships with your patients and colleagues, and then maintain trust in you and the profession by being open, honest, and acting with integrity. And then, as an addition to that, the GMC also provide an additional document which really looks at cosmetic interventions guidance, which is particularly useful for us hair transplant surgeons. And again, it's quite a large document, but essentially goes over things like such as, you know, work within the limits of your competence, obtain consent from your patient yourself, which is relevant particularly in our sector, with the incoming sort of brokers around. Clear discussion on pros and cons, give time to reflect, and that's in regards to the 2-week cool-off period. And then, of course, with any sort of cosmetic surgery and hair restoration surgery, be aware of any vulnerabilities and psychological needs of your patient, and then market your services responsibly. And we'll come on to that in regards to ethical advertising and marketing. So the JCCP and CPSA, again, a very extensive document, and really more for hair transplant surgeons, I guess, but it covers generic knowledge and skills, specialty-specific knowledge and skills, the law, policy, ethics, facilities, etc. It's a great document for any hair transplant surgeon who's thinking about entering the speciality, and also for those who are already practicing, because there's an awful lot of information on there to refer to. The ASA and CAP, so these two organizations essentially are looking at advertising standards and really look at you know, what's going on in the industry. It's a great website to look at, and you can look for search terms, you know, like hair transplant surgery, etc., and it will come up with any recent listings. So you've got misleading ads, any ads causing harm and offense, social responsibility, promotions, etc. And then, of course, you've got the BAHRS, so British Association of Hair Restoration Surgery. So each of our members is required to sign the code of conduct and the professional standards, again, which is really all based on advice by the GMC, the ASA, Royal College of Surgeons, and the ISHRS. ISHRS has its own sort of guidelines and position statements, which are on the website. Some of them include qualifications for scalp surgery, professionalism and the internet, FUE clinical practice guidelines, FUT guidelines are in progress, and you've got the core curriculum and core competencies as well. Royal College of Surgeons, again, a document which we refer to in the BAHRS, and again goes through essentially, what standards we should be keeping up with in order to, remain professional in this arena. So delegation, one of the big topics in hair restoration surgery around the world, and important for us to go over. So position of the BAHRS is that in the UK, surgical steps of a hair transplant surgery